This video on constipation after diarrhea is brought to you by healthhype.com. Please note that the information in this video does not replace the need for a medical consultation. Always speak to your doctor about your symptoms. Diarrhea is a common problem that we all experience every now and then. Most of the time diarrhea is an acute problem. It lasts for only a few days. Usually it is due to eating food or drinking water that is contaminated with viruses, bacteria, or protozoa. Sometimes it may arise with food intolerances or consuming substances that can irritate the bowels. Once diarrhea resolves, our bowel habits should return to normal. This means that stool will be soft but solid and is passed out with ease once or twice a day and sometimes even every second or third day. If the cause of diarrhea does not recur, bowel habits should remain normal. However, this does not always occur. Problems with bowel habit and even with the bowel movement can arise after the diarrhea eases. One of these bowel problems after diarrhea is constipation. It is not uncommon for a person to experience constipation after a bout of diarrhea. Usually it is short-lived and bowel habit will return to normal. Constipation may also alternate with diarrhea in some bowel-related conditions. This may be seen with IBS-M mixed-type irritable bowel syndrome as well as with IBD inflammatory bowel disease. So what causes constipation after diarrhea and what can be done about it? Constipation that arises after diarrhea is usually not serious. It may not even require any treatment. However, a few simple dietary and lifestyle changes can resolve and even prevent constipation after diarrhea. First, it is important to understand what causes this other extreme of abnormal bowel habit. The first and one of the most common causes of constipation after diarrhea is dehydration. As a result of diarrhea, there is a profuse loss of water and electrolytes from the body. This results in varying degrees of dehydration. Without sufficient water in the bowels, the stool cannot remain soft and move with ease through the intestines. It is easily remedied by drinking more water. An oral rehydrating solution or ORS is the better option for rehydrating. Beverages with caffeine and alcoholic drinks should be avoided as these are diuretics that can worsen dehydration. Another common cause of constipation after diarrhea in some people is the use of drugs to counteract constipation. These anti-diarrheal drugs like loperamide should not be the first choice of treatment for diarrhea. However, if it is being used, then it should be consumed according to the recommended dose. Other drugs can also cause constipation, like certain types of painkillers. Therefore, only necessary drugs should be used when recovering from diarrhea. Depending on the severity and duration of the diarrhea as well as the eating habits, it is possible that there is little solid material left in the bowels after the diarrhea resolves. Without any solid material, stool will not be passed out. Therefore, empty bowels could be a possible cause of constipation after diarrhea. Contrary to popular belief, solid foods should not be stopped during diarrhea unless a person is also vomiting profusely. Returning to a solid diet will quickly increase the solid material within the bowels. These foods must be freshly prepared under hygienic conditions. It should also be nutritionally balanced and high in fiber to provide bulk to the stool. After a bout of diarrhea, the bowels may become underactive. This is known as hypomotility. With less movement through the bowels, stool can become hard and bowel movements are less frequent. It may lead to constipation. Hypomotility of the bowels that is not due to any disease can be easily remedied with simple lifestyle changes. Start getting active. Try a short walk, especially after eating a meal. It is important to slowly increase physical activity as the body is still recovering from the diarrhea. Eventually, regular exercise will help to maintain a good bowel habit. Thank you for watching this video brought to you by healthhype.com. Visit our website and subscribe to our YouTube channel for other videos.